Hello everyone. Welcome to Yashoda Hospitals, the Health Talk session. If you've just recovered from COVID, it may not be wise to let your guard down because most of the people these days are presenting with reinfections and possible complications. So here is everything you need to know about post-COVID care and what precautions one must take to resume the normal life. I'm Dr. Lakshmi, and today we have with us Dr. Vijay Kumar, Senior Consultant Physician from Yashoda Hospitals, Secunderabad. Welcome, sir. So, sir, what have we learned in the last 1.5 years, and how was your experience so far?
Yeah, it's been 1.5 years now. One thing we can see, COVID is predictably the most unpredictable disease we have seen in our lifetime. Not only in our lifetime, in the medical history of modern medicine, we have never seen a disease like that. Not only from the suspicious nature of the beginning of the viral illness, and also the myriad symptoms that it has, starting from headache, weakness, fever, cough, motions, like all symptoms related to all organs are present, unlike any other disease. And also the acute infection is so different from other viruses. It not only has one type of pathogenesis, it has got lung fibrosis, then it has got clotting of the blood vessels, then it affects the other chronic organs. So its presentation is also quite atypical. And till now, in the last 1.5 years, we have not found a very suitable antiviral drug yet, although we have some drugs to reduce the inflammation it causes, but we don't have any predictable antiviral agent as of now. So this is a new thing for all of us. Still, things are going to change in the next couple of years, I think.
So, talking about its various presentations, what COVID can present with. So, post-recovery, what are the most complications what we are seeing, and what symptoms should the general public look out for?
Yeah, one thing, as we said, not only the symptoms, acute illness, the acute illness phase lasts for about 28 to 1 month. But beyond that, we also are seeing in this virus symptoms beyond 4 weeks. They're extending up to 3 months, or more than that in some cases, even up to a year. So this is one more new thing with the virus. So starting with the symptoms, the common symptoms beyond 4 weeks are the extreme weakness or lethargy. And I've seen people, even my colleagues, who are having temperature even after 7-8 months. It comes and goes depending on the physical exertion, lasts for an hour or two, and it comes down automatically. It means that thermostat in the brain is not set. It affects the brain cells too. Then they have palpitations. Then they have shortness of breath. They may feel tightness in the chest. They can continue to have loose motions on and off. And the most important symptom most of them complain is called as the brain fog, where they'll have poor memory, concentration is difficult, sleep is difficult, and then they have anxiety, depression. It goes on for more than 3 months also. The other thing is, as I said, the most common is the extreme weakness or fatigue, which if it goes beyond 3 months, then it evolves into a state, we call it as chronic fatigue syndrome. So which has got myriad symptoms, no actual treatment other than routine meditation and other classes. And so this can also go on up to 6 to 9 months.
Do post your queries on this topic and we'll get them answered shortly. So talking about fatigue, we have Mr. Jay asking us from Hyderabad. He wants to know, how long does fatigue last after recovery from COVID?
Usually fatigue and this extreme weakness, most of them, 80 to 85% of them improve between 4 to 12 weeks. That is, up to 3 months it might last. It may not be as severe as in the beginning, but you may have spells of these weakness and fatigue lasting up to 3 months. That is in almost 85 to 90% of the people. 10% of the people go on to have this fatigue, may develop chronic fatigue syndrome, and that may last from 6 to 9 months, but that's not so common. most of you get out of this state of fatigue or weakness in about 3 months' time.
So does this fatigue require medical attention, or would it subside on its own at home and reassurance and rest?
Yeah, basically there's no drug to alleviate this thing. So mostly fatigue almost disappears on its own, but it requires adequate sleep, at least 8 hours sleep. Good hydration, that's one of the things which is important. Some vitamins, if they are deficient, like vitamin D, A and C, those are also slightly helpful. And things like meditation, breathing techniques, slight relaxation exercises, all of this do help. But it doesn't require a specific medication. It will not lead to anything dangerous. At the same time, you have to live with it for 2 or 3 months, but ultimately it will disappear.
So, sir, talking about COVID and post-COVID complications, what is late COVID? What does that mean?
Yeah, usually if you take any viral illness, it usually lasts about 2 to 4 weeks. But in COVID especially, we have seen symptoms going on from even after 4 weeks, lasting 3 to 6 months. The symptoms that do appear after 4 weeks, which go on for 3 to 6 months and beyond, these patients are called as late COVID patients or post-COVID syndrome. And there are multiple symptoms, as we have already told. There's some specific symptoms which can occur with late COVID. One of them we already dealt with is extreme weakness. The other common symptoms is a high pulse rate. People will have about 100, 110 heart rate or pulse rate. Then they have some tightness of the chest. Then they have shortness of breath. Even in simple day-to-day routine activities also they can get it. And other than this, while getting up from a position, this is one of the common symptoms they describe. They feel momentarily dizziness. And loss of taste and loss of smell also can persist and go on for 4 to 12 weeks. Then they can have some abdominal cramps or sometimes loose motions. And these are some of the things which go on. These are called as late COVID. In addition to these symptoms, there are certain organs which behave abnormally because of the COVID. If you take the lung, if there is severe infection in the lung, then they'll have probably lung fibrosis, destruction of the air breathing cells called as the alveoli. So that breathing may be affected in case of the lungs. And if you go to the heart, we have seen that not only the big vessels, the small capillaries are also get blocked even after 4 weeks, causing a condition which leads to heart failure called as cardiomyopathy. If the major vessel is blocked, they can get heart attacks. Heart attacks can happen in a COVID patient even after 4 weeks. Up to 3 months, the risk of a heart attack because of COVID will be there. And if you go to the brain, as I told you, one is called as brain fog, where there's some memory loss and some difficulty in concentrating and doing routine work. Sleep gets disturbed. Other than that, you can also have strokes because of clots. Like as I told you, the blood clots can form anywhere. You can have seizures or fits, and sometimes you'll be more prone to develop Parkinsonism and Alzheimer's also. And if you look at the pancreas, you have diabetes. In COVID, diabetes can be there, COVID-associated diabetes. The COVID can affect your pancreas, it affects your beta cells, so it destroys your ability to produce insulin, so you get diabetes. This is COVID-associated diabetes. And if you look at the kidney, you can have acute renal failure, which can last up to 4 to 8 weeks in some patients. Similarly, most of the other organs are also affected in some way or the other.
Moving on to the next question, we have Mrs. Vimala from Vijayawada. Tan adugutunnaru, కోలుకున్న తర్వాత బ్రీదింగ్ ఎక్సర్సైజెస్ ఎలా చేయాలి లంగ్ ఇంప్రూవ్ అవ్వడానికి?
చాలా కామన్ ఎక్సర్సైజ్, చాలామందికి తెలిసినవి. కొంచెం బ్రీదింగ్ ఎక్సర్సైజ్ ఒకవేళ తెలిస్తే అనులోమ్ విలోమం అని ఉంటాయి, అది చాలా బాగా పనిచేస్తుంది. సెకండ్, అవి తెలియకుండా ఉంటే కామన్గా మనం ఇంప్రూవ్ చేయాలంటే మార్కెట్లోనైతే ఇన్సెంటివ్ స్పైరోమీటర్ అని దొరుకుతుంది. అది ఊతే బాల్స్ అనేది లేవడం లంగ్ కెపాసిటీ పెంచడానికి. అది లేదంటే కామన్గా మనకి బలూన్స్ ఉంటాయి కదా, బలూన్ ఊదడం, అది రోజుకి ప్రాక్టీస్ చేసి 10 నిమిషాలు 2-3 టైమ్స్ బలూన్స్ ఊదడం వలన కూడా లంగ్ కెపాసిటీ అనేది పెరుగుతుంది. అవన్నీ లేకపోయినా కానీ నోరు ముక్కు మూసుకొని గట్టిగా గాలి బయటకని కొంచెంసేపు పట్టుకుంటే లంగ్ కెపాసిటీ కూడా పెరుగుతుంది. సో మామూలుగా ఆహారము, నిద్ర, మాత్రలు కాకుండా ఈ ఎక్సర్సైజ్ చేయడం వల్ల కూడా లంగ్ కెపాసిటీ మెల్లమెల్లగా కుదుట పడుతుంది.
So, sir, talking about exercise and diet now, is there any specific diet that one should follow, or what we have in the market called immune boosters? You think that works for post-COVID care?
Yeah, there's nothing like immune booster which works. The problem in COVID is not the immunity alone. It's the abnormal immunity which causes these diseases. And because of COVID, it takes away so much away from your system and your body. So much loss of muscle is there, loss of protein is there, lot of fat is there. Every organ is affected in some or the other way. So you have to recoup them one by one by supplementing. Diet is an essential part. So it doesn't mean you have to take immune boosters, but the same things like carbohydrate, protein and fat which you used to take, put all your nutrition books aside. Take good amounts of carbohydrate, good amounts of protein, good fat. You can add all the good fats. Eat, this is the time to eat fat also. But you have to eat in intervals, small quantities, more number of times. So fat is very important in improving the cell wall, improving your organ's ability to restructure itself. So don't neglect that. So these things in moderation, everything will work. The other important thing is hydration. Good hydration is always important so that the metabolic pathways in each cell, the mitochondria and the respiratory chain, they start to work and they get to improve them. So these are the two important things. There's nothing like immune boosters or anything. As I said before, if you have deficiencies of vitamin D, if you have deficiency of iron, if you have deficiency of vitamin A, those little things will help. But nothing like Sanjeevani or an immune booster to get over it. It will take time. Usually it takes about 4 to 8 weeks with good nutrition, sleep and good hydration to improve.
Yeah, I think that's important. Apart from balanced diet and physical activity, good sleep is also equally important. Yes. So taking the next question, we have Mrs. Kavita asking from Kadapa. She wants to know if she has to change a toothbrush after recovery from COVID.
Yeah, that's again the common doubts the patients have. Normally in fomites, including toothbrush and other things, the virus doesn't survive beyond a period of 3 days. But obviously, because it is in close contact to your mucosa, you may have doubts. But things like toothbrush probably can be changed. But there's no need to, people are changing their bed sheets, their mattresses and the dress, they're all throwing it off. Nothing survives there. The virus requires human body to survive. It doesn't survive in fomites. It can remain suspended in the air for some time, for an hour or so. It can survive for that much time. By the time it requires a human body to attach.
So, sir, talking about post-COVID care, in general, what % of patients are presenting to your clinic after recovery with other infections or complications?
Yeah, two things. You have asked a very big question, but an important one. Two things happen. One is the immediate after the acute stage. People are, because COVID attacks the immunity system in such a way that your CD4, CD8 and protective lymphocytes go down very badly. So that can lead to a potential increase in infections, so bacterial infections. And second thing, if you are a diabetic, if you are an alcoholic, if you have lot of other comorbid conditions, we are seeing lot of fungal infections, the so-called black fungus or mucormycosis. This happens mostly, it is told in TV and other media, that's only because of steroids and anything. We use plenty of steroids. We've seen diabetics with ketone complications earlier, but never we have seen such a high incidence of mucormycosis. Probably we have seen 3 or 4 mucors in a year. But COVID somehow alters the immune system, and the high dependency of oxygen also may play a role, but mostly COVID affecting the immune system in a diabetic which was not well controlled during the COVID infection. So it is essential that during the infection the blood sugar should be maintained between 140 to 180, and the COVID virus feeds on ketones. If there's ketosis or diabetic ketoacidosis, it is more. It also, the virus feeds on ferritin. That's an inflammatory marker which happens because of COVID. If these two are well within control, if you control your diabetes very well and don't use steroids beyond the required mandate, and if you do not have a situation of inflammation, then the incidence of mucor should come down. The other thing they call is white fungus. White fungus is nothing but candidiasis. Candidiasis is so commonly seen in diabetics and other things routinely, and there's no need to fear about that. The essential thing is you should be able to identify it early so that you can treat it early. And one interesting thing is, it doesn't only the severe cases or those who are admitted to the patient hospitals will have this symptom. It doesn't mean that. Even asymptomatic, mildly symptomatic patients are also having post-COVID symptoms lasting for more than 3 to 6 months. So youngsters who say I am only asymptomatic, I need not worry about it, that's a thing not to be taken lightly, because it can affect in asymptomatic, mildly symptomatic, or those who are in hospitalized patients. In hospitalized patients, probably lung complications are more, but other complications are the same. You can get a heart attack. Don't take that age is a savior. Don't take asymptomatic infection is a savior, and don't forget these things. So I've seen youngsters, asymptomatic patients die at home. In the last couple of weeks, at least we have known 3 or 4 patients just collapsed. They did not have any COVID symptoms also. So be careful. Masking, social distancing, washing, still mandatory for another 1 year at least.
So sir, talking about black fungus, which is rampant in our country now, are there any particular precautions that one should take after discharge from the hospital?
One of the things is avoid mask things. If you are using a mask, don't use it, discard it every day. Avoid things like towels or bedsheets which are very moist or something like that. And the most essential thing is control of diabetes within the range. Use a glucometer so that sugars don't go high. Then good sleep and hydration and diet as advised before. Other than that, no major precautions. If it has to happen, but there should be a high degree of suspicion for mucor. So if you get persistent headache or swelling of the eyelid or a jaw pain or one-sided headache, or again your fever starts coming back, then you have to visit your doctor immediately. Because early, if you treat by removing the fungus from wherever it is and give the drugs, still you can be saved. But if it is delayed by 2 days, 3 days or 4 days, then the fungus grows very rapidly. It can eat away your muscle, it can eat away your brain, it can eat away your brain also, bone also. So that's the rapid spread which can happen. It invades the blood vessels. So it causes a lot of disfiguring and high mortality. So early suspicion is important.
నెక్స్ట్ క్వశ్చన్ మిస్టర్ ప్రవీణ్ ఫ్రమ్ మేదక్. అతను అడుగుతున్నారు, నేను ఈ మధ్యనే కోవిడ్ నుంచి రికవర్ అయ్యి హాస్పిటల్ నుంచి డిశ్చార్జ్ అయ్యాను, కానీ మెంటల్ టెన్షన్ ఎక్కువగా ఉంది, వేరే ఇన్ఫెక్షన్స్ ఏమైనా వస్తాయని. ఇవన్నిటిని ఎలా డీల్ చేయమంటారు?
ప్రాబ్లం ఏంటంటే టెన్షన్ పడితే మన ఇమ్యూనిటీ సిస్టమ్ ఇంకా ఎఫెక్ట్ అవుతుంది. సో టెన్షన్ పడడం మానేసి పాజిటివ్గా ఆలోచించడమే మెయిన్ ఇంపార్టెంట్. ఆల్రెడీ కోవిడ్ నుంచి కోలుకున్నాము, ఇంకా ఫర్దర్గా మీకు ఒకవేళ వేరే కోమార్బిడ్ కండిషన్ అంటే బీపీ కానీ షుగర్ కానీ మిగతా ఏమైనా ఉంటే వాటిని కరెక్ట్గా మందులు వేసుకొని అదుపులో పెట్టుకోవడం ద్వారా మిగతా ప్రాబ్లమ్స్ రాకుండా ఉంటాయి. ఇంతకుముందు చెప్పినట్టుగా ఆరోగ్య నియమాలు పాటించడం, 8 గంటలు నిద్రపోవడం, అండ్ కొంచెం మెడిటేషన్ లాంటివి చేయడం, సింపుల్ ఎక్సర్సైజెస్ చేయడం, ఇవన్నీ ఇంపార్టెంట్. అది కాకుండా ఇంకా స్ట్రెస్, టెన్షన్, ఇంకేమో అయిపోతుంది, ఇంకా కొత్త ఇన్ఫెక్షన్ అని అనుకుంటే ఆ టెన్షన్స్ తగ్గించుకోవడానికి ఈ మన సైకాట్రిస్ట్ని కన్సిడర్ చేయడంలో ఏమాత్రం నష్టం ఉండదు.
Do post your queries on our social media network and we'll get them answered shortly. So sir, now that the COVID picture has become more clearer than what we know from the last year, now that we are seeing many of the people presenting with many complications and reinfections as well, so what general precautions one must take, and otherwise what message do you want to give to the public in general?
సో ఇన్ఫెక్షన్ రాకుండా ఉండడానికి ఎన్ని విధాలుగా మనం ప్రయత్నాలు చేయగలుగుతామో చేయాలి. కోవిడ్ ఇన్ఫెక్షన్ రాకుండా చూసుకోవడమే మన బాధ్యత. ఒక్కసారి వచ్చిందంటే అది 3-4 వారాల్లో తగ్గిపోయిందనే సంతోషం లేదు. 40-50% వాళ్ళలో మనం ఇంతకుముందు చెప్పినట్టుగా లేట్ కోవిడ్ ఆర్ పోస్ట్ కోవిడ్ ప్రాబ్లమ్స్ ఉంటున్నాయి. అందువలన ప్రివెన్షనే బెస్ట్. సో దానికి వ్యాక్సిన్, మాస్కింగ్, సోషల్ డిస్టెన్సింగ్, వాషింగ్ ఎన్నోసార్లు ఎంతోమంది చెప్తున్నారు కానీ ప్రజలకు ఇంకా ఎక్కడం లేదు. అది తెలుసుకోండి. సింపుల్ ఇన్ఫెక్షన్ వస్తుంది, నాకు ఏసిమ్టమాటిక్ వస్తుందని సంబరపడాల్సిన అవసరం లేదు. ఏసిమ్టమాటిక్ వాళ్ళలో కూడా మనం లేట్ కోవిడ్ సిమ్టమ్స్ చాలా చూస్తున్నాం. యంగ్ 20-25 వాళ్ళు తెలిసిన వాళ్ళు కూడా సడన్ డెత్స్ అవుతున్నాయి, కార్డియాక్ డెత్స్. ఎందుకంటే బ్లడ్ క్లాట్ అయిపోయి సడన్గా అవుతుంది. వాళ్ళ హాస్పిటల్ వచ్చే వీలు కూడా అవ్వట్లేదు. ఇవి ఏసిమ్టమాటిక్ పేషెంట్లకు కూడా వస్తున్నాయి. సో ప్రివెన్షన్ ఈజ్ ద ఓన్లీ వే టు గెట్ రిడ్ ఆఫ్ దిస్ డిసీజ్.
So this brings us to the end of this session. Hope all your queries are answered by our doctors here. Do join us on the next session. Stay safe and take care.